A close-up look at a traditional metal frame removable partial denture. Hey everybody, just wanted to give you a close-up look at a lower partial denture. This is a traditional style partial denture with a metal framework and two buckle eye bar clasps that hold it in place. This is going home with a patient today. This is replacing an older partial denture that she had that no longer fit well. One of her old clasps had broken off. She had lost a bit of bone in the back here. Now, you may be wondering why I made a partial denture and not implants like everybody's doing. Well, this particular patient has been missing their back teeth for quite a long time, and to have implants placed there, they would need a lot of bone grafting first, build the bone up before the implants can get placed, and they're just not ready to, or don't want to go through that amount of surgery. So once their partial is in and comfortable, they're okay eating with that. So the steps I took, first I took a study model. From this, had the lab made me a custom tray, and then we border molded it, took an impression. From this impression, they made the final model, and then on that final model, set the teeth up using a bite registration, and this is a model of the patient's upper teeth. Actually, they have a full denture on top. And they made the partial denture. So here we are. So today when they come in, we'll fit it, make any adjustments underneath. If it's rubbing somewhere, I'll check it with some pressure indicating paste, make sure it's not too tight anywhere. We'll check the bite also, make sure that's even all around, and we'll also check the clasps, make sure the clasps are not too tight and not too loose. I had already tried in the framework, so I know the framework fits at the last visit when we did the wax try-in. So now it's just a matter of delivery, and once it's in, then I'll see the patient for adjustments as they need it. Usually in this type of situation, somebody who's a long time partial denture where they'll have probably have a couple adjustments necessary in the beginning, but after that I probably won't see them again for quite a few years. And that's how it was with this patient. When I made their last partial denture. Few adjustments in the beginning, and then it had been years until I saw them again. Okay, thank you so much for watching. See you in the next one.